I'm here with Rod Mitchell, the Australian and New Zealand College of Anaesthetists' new president. Hi Rod, thanks for joining us.
Hi Tanya, pleasure, thank you.
So first of all, it's a big week for you this week. Tell us what's happening for you this week.
So this is the ASM, and at the end of the ASM I have been inducted as the new president, incumbent president. So this is an opportunity now for me to lead our council and moving forward to address some of the key challenges which I think we're facing at the moment.
And let's talk a bit about your background. How did you get to where you are now?
So my background is a little bit different to other presidents probably. I was a remote area GP in Central Australia. My interest was in remote primary health care, Indigenous health and in retrieval medicine. And then somewhat later in life I went back and did my ANZCA and then returned to Alice where I worked as the director of the anaesthesia department. I've been back in Adelaide now for 10 years where I do half-time anaesthesia, half-time ICU with a public to private mix of about 70 to 30. I'm happily married, I've got 4 kids who have all grown up and left home now, so that's me.
And how do you see perioperative medicine evolving in the next few years going into your presidency?
Okay, so perioperative medicine has been evolving now for about the last 20 years. There's been a small band of real visionary colleagues of ours who have recognised the need for improved perioperative care. And they've just been quietly but doggedly working away at this entity, and I think the fruits of all that work is about to sort of come to fruition now. So I'm thinking in the next few years there will be a much greater awareness of the reality that patient-focused, evidence-based, multidisciplinary perioperative care really results in better patient outcomes. And I think that there will be a greater awareness of the role of anaesthetists in that process. I think that in the next few years we'll start to see more people who are calling themselves and recognised as perioperative specialists. They'll have a qualification, they'll belong to a formal leadership group, and they'll be the people who are driving the education, training, professional standards and research in perioperative medicine. It will be very much a multidisciplinary collaborative approach. It will be including anaesthetists and surgeons, but also intensivists, physicians, GPs, government departments, health, and importantly the community and our patients.
In terms of some of the challenges in the next couple of years, I know earlier you spoke to me a little bit about equity and welfare and that sort of thing. Tell me a little bit about that.
Okay, so there are a number of opportunities and challenges which we have now. We've been very good for a long time at providing really excellent patient care. So through education training, professional support, and research, we provide just absolutely top of the class clinical care to our patients. Our challenge is to make sure that there is equity of access to that clinical care. So we're really good at doing it, we've just got to make sure that people can access it. And at the moment there are 3 elements of our community which I don't think do have equity of access. There's our regional neighbours, so particularly New Guinea, Timor and the Pacific Islands. There's our rural communities where there's an ongoing maldistribution of our workforce. And then there are those marginalised members of our community, particularly Indigenous people, but also importantly migrants and refugees. So these are very complex issues and there's equity of access of treatment and outcomes. But there are things which we can do individually as a college and collectively with other stakeholders to try and improve equity in anaesthesia, pain medicine and perioperative medicine. The other issue you mentioned, doctors' health and wellbeing, is a really important issue too. So we thought we were doing pretty well at this. We've become aware more recently that there's a lot of work to be done, and particularly with our trainees. There's been a lot of activity in this, and once again both ourselves but other stakeholders. So our challenge at the moment is to try and bring all these elements together into a coherent and communicable framework, which is going to evolve around really sort of promoting good health, identifying and addressing those issues which are causing poor health, and then providing support as is necessary.
So you've flown over from Adelaide to be here for a week.
Yep.
Are you enjoying Sydney?
Well, Sydney's great. I mean, you can see fantastic weather, and Sydney's always a good place to visit.
Well, thank you so much for joining us and good luck.
Yeah, thanks a lot, Tina. Thanks a lot.